I will start off with our numbers. Today we are reporting 3,312 cases in Ohio, and the age range is now less than 1 to 101 years of age, with a median age of 54. We are still equal, about 51% females, 49%, close to 49% males. And still a high percentage, because of our testing right now is aiming at the most vulnerable and sick, is still 27% hospitalized. 9% of our cases are ending up needing ICU at some point in their course. And it's still almost 20% healthcare workers, 4% of long-term care facilities. I have a wonderful team led by doctors, and Director Maureen Corcoran has been working tirelessly along with Mary Applegate, a physician at Medicaid, Dr. Hurst, Seatsgar, state epidemiologist, and numerous other folks on that team. I always hate to say names, but I just want to say thank you. Really trying to work alongside our nursing home partners when they do end up having a case or someone infected. Those folks are doing a wonderful, wonderful job. So you'll find a lot more of this on our website. As always, coronavirus.ohio.gov for all sorts of tips, information, resources, and we'll keep putting even the Battelle link. We'll try to get everything on our website so you can have a one-stop shop. And don't forget about our call center, 833-4-ASK-ODH. It's the number often behind us. These are wonderful folks who are working tirelessly to answer your calls. Do remember, I know a lot of us are getting stressed during this. I mentioned it earlier in the week, but these are really good people on the other side of the phone, and they're really trying to help. So remember that there's a person on the other end of that call when you call. I know there's a lot of questions you have and frustrations, and they'll try to help point you in the right direction. I do want to share some other information today. We will be talking about putting more and more data on our website. One of the things that we've had a lot of questions about is zip code data. Could we do our cases by zip code? And already in Ohio, some of the larger metropolitan areas have been able to share zip code level data. It's helpful and it's not helpful. So I'd like to explain to everyone at home why, and also to my friends in the media. We've been doing a really good job of trying to put context around some of these numbers. And so I ask for your help as well, because zip code tells you some things, but it doesn't tell you everything. It can look like you have a hot spot, but remember, what we're telling you are cases of folks who happen to get tested. We've had tons and tons. The majority of Ohioans are being told, even when they're told by their physician that they have COVID-19, they're not being tested. And so a hotspot might not be a hotspot. It might just be a reflection of the amount of testing in a given area. And so we have to be very careful how we interpret this. On a given street, my street, we know that a lot of people might be asymptomatic, but actually have the disease or be about to show the symptoms of the disease. And using these case numbers doesn't tell you who's now better. So we have to be very, very careful as we interpret zip code, and we're working very closely with our local health departments. Remember, we have 113 amazing local health departments. They are independent, they have boards of health, and they've been working to try to decide, in some of our areas, a zip code could have less than 100 people in it. And so we're trying always to balance people's individual and private information with trying to share with you everything we know as we know it. So please know that we're in conversations. We'll be sharing more and more layers of zip code. We're still in debate about saying if it's below a certain population, do we not perhaps give that particular zip code, because it would just be too much of an invasion of someone's individual privacy. As we have more numbers and as there's more widespread testing, of course, we can give all that information in ways that doesn't de-identify someone. So I appreciate everyone's patience as we try to get that data out to you. A special appreciation to our local health departments for all they are doing.